if you're interested, because you just not understanding the words, be able to understand something about patients. And by looking at them, I can tell them, you know, you have, good morning, have daytime bruxism. So I tell them, okay, you have to promise me to look after one person, yourself. You have to know when you are clenching your teeth at daytime. You have first to acknowledge that you're clenching the teeth. You have to, I'm clenching my teeth. You have to try to open the mouth to try, because sometimes it's very hard. Like, do you imagine when you are placing ceramic on the incisal edge? For example, you do the correction and you try to be very precise with the way your brush is going to. Did you ever mention that you clench your teeth that time?
Of course I do.
Because in that case you're more precise, yes? You just concentrate.
I'm wearing a splint when I'm building
Super,
the case.
great. Because that's how we concentrate. When I bond veneers, I always catch myself clenching teeth when I'm position them, because that's the way to be precise.
Yeah.
And it's really so thin work that, you know, slight mistake and you're fucked.
Yeah.
So I tell the patient, try to acknowledge also what led you to this clenching. And if you acknowledge that led to the clenching, what you do next, before this moment in your life appears again, you say to yourself, I'm going to clench. And I will try not to clench, and try not to do that. Or wear splint at that time, please. Why not?
This time, most of the times, I catch myself to. I already have a stop breathing. Yeah, and I have always a silicone splint in my drawer for these cases.
Good. So it's also an option, but I can tell you that, for example, after the appointment, I scheduled for the diagnostics in 2 weeks. And there were cases in my life when a patient called me and said, no, doctor, we will not come. Not because we don't want to, because, well, we started doing what you say, and my level of pain decreased. I don't need to be treated because, for example, they have good occlusion, good teeth, they don't need any dentistry. The only problem is that they have this parafunction at daytime, which led to the pain. So sometimes it's not that the dentistry we have to do, sometimes it's behavior changes that we have to do. So it's not occlusion, it's what we do with occlusion. So, okay, so let's go to so we've seen the joints. We can say that Panayotis has very good, at least bone structures of the left joint. He has some problems maybe from the past on his right joint. Maybe it was a trauma, I don't know. Maybe because he has missing teeth also, I don't know. I don't know. But let's see what we can say about his occlusion. So we switch off this mode. We close the X range, we don't need it right now. And let's see the occlusion. So first was, I don't see uncontrolled movements here. Maybe we didn't call them that. And okay. And I have to be sure, because we call them uncontrolled, no? I don't see them here.
А зуб, который ушел вниз, я не могу его с ортодонтия приподнять обратно?
Можешь, конечно, можешь.
Я поэтому говорю, что сделать место для окклюзии поправили, ну, не знаю при каком условии протокола, Семен я.
Let's see, what Panayotis is asking, does he need to upright his second molar on the right side? I don't know, maybe its tooth is not a problem at all. Maybe we don't need to upright it. Let's see. Because even for implant placement, just for the crown, I wouldn't upright it, I would just make slight stripping, that's it. I don't think it's very badly inclined. Of course it's better to upright it, it's just a matter of do we need to do that or not. So, have you noticed that what I noticed yesterday, remember that he has a deviation to the right side. Look. Remember? And I was thinking that maybe this is this canine that is to be in charge of that. Remember that he couldn't go to the left side? Actually, I was worrying maybe it's not yours, but right now, remembering how that xography was, it's Panayotis. Very good. So what I can do is I can have a look at the contacts. Let's have a look at the contacts here. But because the model is green, okay, at least the upper model is white. So, but if we just remove the upper model, oh, it's white here too. Good. Yes. So here, let's see his movement again.
Το δεύτερο. Yes.
So let's try to see how Panayotis is. Let's do the other. Let's compare. This is when Panayotis was, I think, more behaving properly.
Excuse me for a minute.
Yeah, of course.
Я кофе хочу.
Не, слушай, мне так слишком много кофе во мне.
Can I ask you something?
Yes, of course.
This system is for sure very sophisticated and very accurate, and you thought everything about this. I saw that also. I have just to ask you something. I saw, for example, that there are some features in some advanced scanners that you can write, you can record actually, not
The movements.
the movements, yes.
Tree shape is going.
Yes,
tell it,
yes,
yes,
yes.
but it's not that, because you understand that for that you have to scan from the outside.
Yeah, yes, you have to.
And can you imagine the level of distortion?
Sometimes it's not possible, probably.
So before we was buying iTerra, I was dreaming about free shade because of this function that he could record the position, until I realized that it's just a marketing tool.
So it's just a marketing.
Yeah. Maybe free shape, if they would be smarter, would go in collaboration with someone who will offer some additional things. Like Mojo, they use the special, like clutch, yes, or special tool outside. We use flags, something that has to be controlled outside, not to the inside.
I understand.
Because the scanning, that you see with the scan yesterday, how important the distance to the scan.
Yes, yes.
The more the distance, scanning doesn't work that way, it will be distorted. So